Hello viewers, today we are going to discuss about safety of scans, X-rays, CT scans, MRI, all these things in pregnancy. Many people have this fear that too many scans, is that safe to my baby? We are getting too many ultrasound scans these days, one for testing for chromosomal anomalies, one for growth anomaly scan. Altogether, each pregnant woman might end up having 3 to 5 scans during pregnancy as a routine, and if there is high-risk cases or twin pregnancies, the number of scans are increased enormously. So first thing I have to reassure is ultrasound scanning is the safest scan in pregnancy. The reason being, it uses sound waves, and sound waves is almost as if you are hearing many people talking. It is almost the same effect that goes into the abdomen, and it's very minimal effect on the fetus or the growing baby. So if you have to get a scan, this is the simplest and easiest and safest form of scanning in pregnancy. And these days, I think we are moving out of concerns with ultrasound scan, but many people are still worried about any other scan when there is need in pregnancy. Suppose if someone falls and they are pregnant and they need an X-ray of hand or wrist or leg, they get too concerned. It's an X-ray. Is it safe during pregnancy? Will that affect my growing baby? X-ray, before I talk about the radiation exposure, anyone, when we are sitting inside, we have a background radiation, means the cosmic rays around us, everything around us, it will have some amount of radiation. All this is calculated as a background risk of radiation. When we are not worried about the background risk of radiation, one X-ray, if you are exposed to, suppose a hand X-ray, that will be almost like exposing yourself into one in maybe few weeks of this background radiation. So when you compare it with the whole lifetime, you will be exposed much more amount of radiation compared to one X-ray. So X-ray, but when it's taken for hands and legs, that's very less. But when it's taken to the abdomen, breast and everything, the exposure of X-ray is slightly higher. So we usually weigh the benefit and risk before we say, is this X-ray safe for you or not? So we try and avoid X-rays for abdomen and breast, but when it is required for clinical purpose, we say it is still very safe, because the risk of the radiation exposure is far less. Almost 1 in 100,000 to 10,000 people will get affected. And the next comes to is a CT scan. CT scan we try and avoid in pregnancy as much as possible, because the same amount of radiation is many times more than one exposure to the X-ray. CT scan will have a bit more of radiation compared to any other forms. But when it is really needed for any one particular clinical situation, which is unlikely in most of the normal pregnancies. So we do go for it only with a very careful benefit analysis. And the next form is an MRI scan. MRI scan is reasonably safer compared to CT scan in pregnancy. It uses a magnetic field around you. So it is not mainly the X-ray or anything, but it's a magnetic field. So the radiation exposure with this and the amount of or damage or any effect on the unborn baby is almost negligible with MRI, the recent MRI scans. So if we encounter any particular problem in pregnancy, like if there is a placenta or the afterbirth of the baby that is very low down, and we have to analyze whether that is quite stuck or anything, we will still go for an MRI if the scan, the ultrasound scan, is not very promising or very accurate. Then we still advise these women to go for an MRI scan, as benefit of that will outweigh and overweigh the risk of these MRI scans. So overall, most of the scans are okay in pregnancy. We try and avoid CT scans, but prefer MRI when it is needed, and using contrast we'll try and avoid unless it is required. But X-ray reasonably safe, ultrasound is very safe. One of the most common questions asked by women these days are, there is a lot of malls and exposure of metal detectors, so they do get concerned about use of metal detectors, and when they go to airport, there's lots of these detector things. So many people will come and ask, is it safe to go through these? It is really relatively safe, and as I was mentioning earlier, the background risk, it is almost equivalent to the background risk. The exposure to these is really negligible, so they are relatively very safe. One more important thing is many people do worry about all these exposure to the metal detectors and everything, but forget the most common things that they use that can still cause radiation is cell phones. I can see people using hours and hours of being on the cell phone without realizing that this could be any cause of any damage to the unborn baby. Though it is not evidence-based or proven that it affects the unborn baby in any way so far, we still advise women not to use cell phones for long hours, and if they have to, don't place them next to the belly all the time, but they can switch it off and keep it to the minimum.